Fetal movement is a very important milestone in the journey of a woman during pregnancy. It is very exciting for the fathers also when they feel the baby movement on touching the abdomen of the mother. Hi friends, this is Dr. Rajeshwari Reddy. I'm an obstetrician, gynecologist and a laparoscopic surgeon from Hyderabad. So today we will be talking about fetal movements. So, what is a fetal movement? It is the movement of the baby inside the mother's womb, and it is considered to be a good sign of a healthy baby. So, when does a mother start perceiving fetal movements? Fetal movements are first felt between 16 to 20 weeks of gestation, just like a small flutter. Usually, mothers who are primi-gravidas, which is first time mothers, they feel it at a little later stage, as in 18 to 20 weeks, and multiparas who are second time or third time mothers feel it a little earlier, as in 16 to 18 weeks of gestation. So, when in mid trimester, a mother can feel fetal movements all over as the baby is small and has a lot of space to roll around in the womb. Whereas in the third trimester, it's only a small kick here and a moment there. Usually, the fetal movements gradually increase from 20 weeks to about 32 weeks. So, after 32 weeks, it kind of stabilizes because of the increased size of the babies. There will be very restricted movements. So, fetal kick count has to be started only after 28 weeks. It's very difficult to do fetal movements below 28 weeks. There are many factors affecting the fetal movements. In obese mother, there might be less perception. It's not like the baby is not moving, but because of the excessive obesity, they are not able to perceive the fetal movements, and so also other people also, even if they place their hand on the abdomen, it's very difficult to perceive the fetal movements. In certain conditions like diabetes, hypertension, oligohydramnios, which is reduced amniotic fluid, or polyhydramnios, which is increased amniotic fluid, there can be reduced fetal movement indicating fetal distress. So, how do you check fetal movements? When a mother is trying to keep a check on the fetal movements, she has to be very relaxed mentally, should not be watching television or meddling with the phone or listening to music, nothing. We recommend that the mother lies in left lateral position or is very comfortable on a reclining sofa and put both her hands on her tummy and put all her mind into observing the fetal movements. It is specially recommended after eating food. We do not recommend counting fetal movements on an empty stomach. So, if the mother is not able to feel the fetal movements, we ask the mothers to walk around a little and maybe have a little bit of snack and then again sit back and try to perceive the fetal movements. There's something called Cardiff fetal kick count, which says there has to be 10 fetal movements within 12 hours. That is from morning to evening. If a mother can feel 10 fetal movements, that is good enough. We also ask to do fetal kick count, which is, as I told you, asking the mother to sit and count the fetal movements. So, we expect at least 10 movements in 2 hours. So, if you feel 10 movements within 1 hour, then you are good to leave it. But our expectation is 10 movements in 2 hours. So, if you feel there is reduced fetal movements after 28 weeks, then please reach out to the hospital for an ultrasound or a NST. As soon as you reach the hospital, your doctor will probably do a thorough examination of the abdomen and also look for fetal heart sound, and then probably go for an ultrasound or NST. If you feel there are reduced fetal movements after 28 weeks, then please report to your doctor. They may even choose to do a ultrasound or a NST. 90% of the time, it turns out that everything is fine. But even if it is an extra visit to the hospital, please do it rather than ignoring reduced fetal movements. Fetal movement is a very important parameter of fetal well-being. So, how do you assess if it is a twin pregnancy? In the early twin pregnancy, probably in the second trimester, people can make out that the baby movement on the right side is different and on the left side is different. But at later stages, it is definitely very difficult to differentiate between the two babies in a twin pregnancy. But the rules for fetal kick count is the same. Apart from having a keen eye on fetal movements, this is also one activity where the mothers really bond with the baby. So after 20 weeks, we all know that after 20 weeks, the baby can hear the mother talk. It does listen to the mother's voice. So it's very important that we encourage the mothers to talk to their babies, and babies also have increased heartbeat or move a little more when they hear melodious sounds, as in the mother singing, or the bond is also better established when the mother is caressing the womb, as in when observing fetal movements, or even when the mother is just sitting casually. It is very important that the mother's hand is on the womb caressing the baby, so that a better bond is established. So, as I explained, fetal movement has a lot of significance in the journey of pregnancy, and it talks a lot about the baby well-being. So, be very keen about observing fetal movements after 28 weeks of gestation. Thank you.